1. Beta blockers reduce blood pressure by increasing cardiac output. True or false? Answer: false. Rationale: beta blockers reduce blood pressure by decreasing heart rate and cardiac output through blockade of beta-adrenergic receptors, particularly in the heart. 2. Warfarin is an anticoagulant that requires regular INR monitoring. True or false? Answer: true. Rationale: warfarin affects the clotting cascade and has a narrow therapeutic index, so INR, International Normalized Ratio, must be monitored regularly to prevent bleeding or thrombosis. 3. Acetaminophen overdose primarily causes nephrotoxicity. True or false? Answer: false. Rationale: acetaminophen overdose primarily causes hepatotoxicity due to the accumulation of a toxic metabolite in the liver. 4. Naloxone is used to reverse the effects of benzodiazepine overdose. True or false? Answer: false. Rationale: naloxone is an opioid antagonist used to reverse opioid overdose. Flumazenil is used for benzodiazepine overdose. 5. Calcium channel blockers are contraindicated in patients with severe bradycardia. True or false? Answer: true. Rationale: calcium channel blockers can further decrease heart rate and conduction, which may worsen bradycardia. 6. Insulin glargine is a long-acting insulin that should not be mixed with other insulins. True or false? Answer: true. Rationale: insulin glargine maintains a steady level over 24 hours and should not be mixed with other insulins due to pH differences and altered absorption. 7. Furosemide can cause hypokalemia as a side effect. True or false? Answer: true. Rationale: furosemide is a loop diuretic that promotes the excretion of potassium, increasing the risk of hypokalemia. 8. Antacids should be taken concurrently with enteric-coated medications for best absorption. True or false? Answer: false. Rationale: antacids can interfere with the absorption of enteric-coated medications by altering gastric pH and dissolving the coating prematurely. 9. Digoxin toxicity is more likely in patients with hypokalemia. True or false? Answer: true. Rationale: hypokalemia increases sensitivity to digoxin, raising the risk of toxicity, including arrhythmias. 10. SSRIs increase serotonin levels by inhibiting its reuptake in the synaptic cleft. True or false? Answer: true. Rationale: selective serotonin reuptake inhibitors, SSRIs, block the reabsorption of serotonin, increasing its availability at synaptic sites. 11. Morphine can cause respiratory depression, especially at high doses. True or false? Answer: true. Rationale: morphine is a potent opioid that can suppress the respiratory center in the brainstem, especially in opioid-naive patients or at high doses. 12. Vancomycin should be infused quickly to reduce the risk of red man syndrome. True or false? Answer: false. Rationale: vancomycin must be infused slowly to avoid red man syndrome, a histamine reaction causing flushing and hypotension. 13. Nitroglycerin should be stored in a dark, tightly closed container. True or false? Answer: true. Rationale: nitroglycerin is sensitive to light and air, which can degrade its potency, so it must be stored in an appropriate container. 14. Proton pump inhibitors work by increasing gastric acid production. True or false? Answer: false. Rationale: proton pump inhibitors block the H+/K+ ADPase enzyme in gastric parietal cells, reducing acid secretion. 15. The peak level of a drug is the highest concentration in the bloodstream after administration. True or false? Answer: true. Rationale: peak level refers to the maximum concentration of a drug in the blood, used to evaluate therapeutic effectiveness and toxicity. 16. Tetracycline antibiotics can safely be taken with milk. True or false? Answer: false. Rationale: calcium in milk binds with tetracyclines, reducing their absorption in the gastrointestinal tract. 17. Heparin's effects can be reversed with protamine sulfate. True or false? Answer: true. Rationale: Protamine sulfate binds with heparin to neutralize its anticoagulant effects in cases of overdose or bleeding. 18. Albuterol is a beta-2 agonist used for acute asthma attacks. True or false? Answer: true. Rationale: albuterol stimulates beta-2 receptors in bronchial smooth muscle, causing bronchodilation in acute asthma episodes. 19. MAO inhibitors can be safely taken with aged cheese. True or false? Answer: false. Rationale: amylase interact with tyramine-rich foods like aged cheese, which can cause a hypertensive crisis due to excessive norepinephrine release. 20. Aspirin should be avoided in children with viral infections due to the risk of Reye's syndrome. True or false? Answer: true. Rationale: aspirin in children with viral infections can trigger Reye's syndrome, a potentially fatal condition causing liver and brain swelling. 21. Metformin is safe to administer before a CT scan with 4 contrast. True or false? Answer: false. Rationale: metformin should be held before and after contrast studies due to the risk of lactic acidosis if renal function is impaired. 22. Clopidogrel is used to prevent platelet aggregation. True or false? Answer: true. Rationale: clopidogrel is an antiplatelet agent that inhibits ADP-mediated platelet activation, reducing clot formation risk. 23. Levothyroxine should be taken with food for best absorption. True or false? Answer: false. Rationale: levothyroxine is best absorbed on an empty stomach, ideally 30 to 60 minutes before breakfast. 24. Benzodiazepines enhance GABA activity in the brain. True or false? Answer: true. Rationale: benzodiazepines bind to GABA-A receptors, increasing the inhibitory effect of GABA, promoting sedation and anxiolysis. 25. The half-life of a drug determines how quickly it is eliminated from the body. True or false? Answer: true. Rationale: the half-life reflects the time required for the drug's plasma concentration to reduce by half and influences dosing schedules. 26. Corticosteroids can cause hyperglycemia as a side effect. True or false? Answer: true. Rationale: corticosteroids promote gluconeogenesis and reduce peripheral glucose uptake, leading to elevated blood glucose levels. 27. ACE inhibitors commonly cause a productive cough. True or false? Answer: false. Rationale: ACE inhibitors cause a dry, non-productive cough due to bradykinin accumulation in the respiratory tract. 28. Lisinopril is a beta-blocker used to treat hypertension. True or false? Answer: false. Rationale: lisinopril is an ACE inhibitor, not a beta-blocker. It works by inhibiting the renin-angiotensin-aldosterone system. 29. Anticholinergic drugs may cause dry mouth and urinary retention. True or false? Answer: true. Rationale: anticholinergics inhibit parasympathetic activity, leading to side effects like dry mouth, blurred vision, and urinary retention. 30. Phenytoin can cause gingival hyperplasia as a long-term side effect. True or false? Answer: true. Rationale: phenytoin is an antiepileptic drug associated with gingival overgrowth due to its effects on fibroblasts and collagen metabolism. 31. Methotrexate is a chemotherapy agent that also treats autoimmune conditions. True or false? Answer: true. Rationale: methotrexate inhibits DNA synthesis and cell replication, making it effective in treating cancer and autoimmune diseases like rheumatoid arthritis. 32. The antidote for acetaminophen overdose is naloxone. True or false? Answer: false. Rationale: the antidote for acetaminophen toxicity is N-acetylcysteine, which replenishes glutathione to detoxify the liver. 33. Dopamine at low doses improves renal perfusion. True or false? Answer: true. Rationale: at low doses, dopamine dilates renal arteries via dopaminergic receptors, enhancing kidney perfusion and urine output. 34. Isoniazid can cause peripheral neuropathy as a side effect. True or false? Answer: true. Rationale: isoniazid interferes with vitamin B6 metabolism, which may lead to peripheral neuropathy unless supplemented. 35. A side effect of lithium toxicity is tremor and confusion. True or false? Answer: true. Rationale: lithium has a narrow therapeutic range and toxicity can cause tremors, confusion, nausea, and ataxia. 36. All antibiotics are safe to use during pregnancy. True or false? Answer: false. Rationale: some antibiotics, such as tetracyclines and fluoroquinolones, are contraindicated in pregnancy due to teratogenic effects. 37. Atropine is used to treat bradycardia. True or false? Answer: true. Rationale: atropine is an anticholinergic that increases heart rate by blocking parasympathetic stimulation. 38. Amiodarone may cause thyroid dysfunction as a side effect. True or false? Answer: true. Rationale: amiodarone contains iodine and can cause both hypo and hyperthyroidism due to its effects on thyroid metabolism. 39. Statins reduce LDL cholesterol and are best taken in the morning. True or false? Answer: false. Rationale: statins are usually taken at night since the liver produces most cholesterol during sleep, enhancing drug effectiveness. 40. Rifampin can cause urine and body fluids to turn orange red. True or false? Answer: true. Rationale: rifampin is known for this harmless but notable side effect due to its pigment properties. 41. Glucagon is used to treat severe hypoglycemia in unconscious patients. True or false? Answer: true. Rationale: glucagon stimulates hepatic glycogen breakdown, rapidly increasing blood glucose levels in emergencies. 42. Antibiotic resistance can occur when patients do not complete prescribed courses. True or false? Answer: true. Rationale: incomplete courses allow bacteria to survive and potentially develop resistance to antibiotics. 43. Benzonatate is used as a stimulant for cough. True or false? Answer: false. Rationale: benzonatate is a non-narcotic antitussive that suppresses cough by anesthetizing respiratory stretch receptors. 44. Lidocaine can be used as an antiarrhythmic. True or false? Answer: true. Rationale: lidocaine is a class IB antiarrhythmic drug used to treat ventricular arrhythmias by stabilizing cardiac membranes. 45. Nitrates relieve angina by causing vasoconstriction. True or false? Answer: false. Rationale: nitrates work by vasodilation, reducing myocardial oxygen demand and relieving chest pain. 46. Alendronate should be taken with food to enhance absorption. True or false? Answer: false. Rationale: alendronate is taken on an empty stomach with a full glass of water and requires remaining upright to prevent esophageal irritation. 47. Buspirone is a non-sedating anxiolytic. True or false? Answer: true. Rationale: buspirone treats anxiety without sedative effects, making it suitable for long-term use without dependence. 48. Penicillin allergy may also cause cross-sensitivity to cephalosporins. True or false? Answer: true. Rationale: penicillins and cephalosporins share a beta-lactam ring, posing a risk of cross-reactivity in allergic individuals. 49. A black box warning indicates a mild side effect. True or false? Answer: false. Rationale: a black box warning is the FDA's most serious warning, highlighting severe or life-threatening risks. 50. Methyldopa is a safe antihypertensive in pregnancy. True or false? Answer: true. Rationale: methyldopa is considered safe for treating high blood pressure during pregnancy due to its minimal fetal effects. 51. Ciprofloxacin can cause tendon rupture as a rare side effect. True or false? Answer: true. Rationale: fluoroquinolones like ciprofloxacin are associated with increased risk of tendinitis and tendon rupture, especially in older adults. 52. Chlorpromazine is an antidepressant medication. True or false? Answer: false. Rationale: chlorpromazine is a typical antipsychotic used to treat schizophrenia and severe behavioral disorders, not depression. 53. Diltiazem is both an antihypertensive and an antiarrhythmic. True or false? Answer: true. Rationale: diltiazem is a calcium channel blocker used for hypertension and atrial arrhythmias, such as atrial fibrillation. 54. Levodopa is converted into dopamine in the brain to treat Parkinson's disease. True or false? Answer: true. Rationale: levodopa crosses the blood-brain barrier and is converted into dopamine, improving motor symptoms in Parkinson's patients. 55. Antihistamines block histamine receptors to reduce allergic symptoms. True or false? Answer: true. Rationale: antihistamines block H1 receptors, decreasing allergy symptoms like sneezing, itching, and swelling. 56. Bupropion increases the risk of seizures, especially at high doses. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold, particularly in patients with eating disorders or when taken at high doses. 57. Hydralazine causes vasoconstriction to raise blood pressure. True or false? Answer: false. Rationale: hydralazine is a vasodilator that relaxes arteriolar smooth muscle, lowering blood pressure. 58. Antacids can interfere with the absorption of many medications. True or false? Answer: true. Rationale: antacids can alter gastric pH and bind to certain drugs, affecting their bioavailability and effectiveness. 59. Sucralfate should be administered after meals for best effect. True or false? Answer: false. Rationale: sucralfate forms a protective barrier over ulcers and is most effective when taken on an empty stomach before meals. 60. Phenobarbital is a barbiturate used to treat seizures. True or false? Answer: true. Rationale: phenobarbital enhances GABA activity in the CNS and is used as a long-acting anticonvulsant, especially in pediatric patients. 61. Furosemide is a potassium-sparing diuretic. True or false? Answer: false. Rationale: furosemide is a loop diuretic that causes potassium loss, increasing the risk of hypokalemia. 62. Tetracycline should not be given with dairy products. True or false? Answer: true. Rationale: calcium in dairy binds with tetracycline, reducing its absorption and therapeutic effect. 63. Warfarin therapy requires monitoring of the INR level. True or false? Answer: true. Rationale: INR is used to monitor warfarin's anticoagulant effect and prevent bleeding or clotting complications. 64. Aspirin should be avoided in children due to the risk of Reye's syndrome. True or false? Answer: true. Rationale: aspirin use in children, especially during viral illnesses, can lead to Reye's syndrome, a serious condition affecting the liver and brain. 65. Flumazenil is used to reverse opioid overdose. True or false? Answer: false. Rationale: flumazenil reverses benzodiazepines. Naloxone is the antidote for opioid overdose. 66. Insulin glargine is a long-acting insulin with no peak. True or false? Answer: true. Rationale: insulin glargine provides steady, long-term blood glucose control with minimal peak effect, reducing hypoglycemia risk. 67. Epinephrine is used to treat anaphylaxis. True or false? Answer: true. Rationale: epinephrine causes bronchodilation and vasoconstriction, reversing life-threatening symptoms of anaphylaxis. 68. Anticholinergic drugs increase salivation and GI motility. True or false? Answer: false. Rationale: anticholinergics reduce secretions and slow GI motility by blocking parasympathetic activity. 69. Ondansetron is an antiemetic that blocks serotonin receptors. True or false? Answer: true. Rationale: ondansetron blocks 5-HT3 serotonin receptors in the brain and GI tract, preventing nausea and vomiting. 70. Nitroglycerin should be stored in a dark glass container. True or false? Answer: true. Rationale: nitroglycerin is light and heat-sensitive and should be kept in its original container to maintain potency. 71. Metoclopramide is used to treat constipation. True or false? Answer: false. Rationale: Metoclopramide increases GI motility, but is mainly used for nausea, GERD, and gastroparesis, not constipation. 72. Beta blockers can mask the symptoms of hypoglycemia. True or false? Answer: true. Rationale: beta blockers can blunt sympathetic responses like tachycardia, making hypoglycemia harder to detect. 73. Vancomycin requires peak and trough levels to be monitored. True or false? Answer: true. Rationale: monitoring peak and trough levels ensures therapeutic effect and reduces nephrotoxicity or ototoxicity risks. 74. Isotretinoin is safe to use during pregnancy. True or false? Answer: false. Rationale: isotretinoin is highly teratogenic and contraindicated during pregnancy due to severe fetal defects. 75. Digoxin increases the heart rate and cardiac output. True or false? Answer: false. Rationale: digoxin slows the heart rate while increasing myocardial contractility, improving cardiac output. 76. Lorazepam is a short-acting benzodiazepine used for anxiety. True or false? Answer: true. Rationale: lorazepam is commonly used for anxiety, sedation, and seizures due to its rapid onset and effectiveness. 77. Levothyroxine should be taken at bedtime with food. True or false? Answer: false. Rationale: levothyroxine is best absorbed on an empty stomach in the morning to ensure consistent absorption. 78. Propranolol is a selective beta-1 blocker. True or false? Answer: false. Rationale: propranolol is non-selective, blocking both beta-1 and beta-2 receptors, affecting heart and lungs. 79. Acetylcysteine can be used to loosen thick mucus in cystic fibrosis. True or false? Answer: true. Rationale: acetylcysteine is a mucolytic that breaks disulfide bonds in mucus, making it easier to clear. 80. Phenytoin can cause gingival hyperplasia. True or false? Answer: true. Rationale: gingival overgrowth is a known side effect of phenytoin, especially with poor oral hygiene. 81. Spironolactone causes potassium loss. True or false? Answer: false. Rationale: spironolactone is a potassium-sparing diuretic and can lead to hyperkalemia. 82. Lactulose is used to treat hepatic encephalopathy. True or false? Answer: true. Rationale: lactulose reduces ammonia levels by trapping it in the colon and promoting its excretion. 83. Carbamazepine can cause agranulocytosis. True or false? Answer: true. Rationale: carbamazepine carries a risk of severe blood dyscrasias like agranulocytosis, requiring regular CBC monitoring. 84. All antihypertensive medications can be stopped abruptly. True or false? Answer: false. Rationale: abrupt discontinuation can cause rebound hypertension or other complications, and tapering is recommended. 85. Acetaminophen has anti-inflammatory effects. True or false? Answer: false. Rationale: acetaminophen provides analgesic and antipyretic effects, but lacks significant anti-inflammatory properties. 86. Heparin is safe to administer intramuscularly. True or false? Answer: false. Rationale: heparin is given subcutaneously or intravenously. IM administration increases risk of hematoma. 87. Clopidogrel is an antiplatelet medication. True or false? Answer: true. Rationale: clopidogrel inhibits ADP-induced platelet aggregation to prevent thrombotic events. 88. MAO inhibitors interact safely with tyramine-rich foods. True or false? Answer: false. Rationale: tyramine-rich foods can trigger hypertensive crisis when taken with MAO inhibitors due to increased norepinephrine. 89. The therapeutic range for theophylline is narrow. True or false? Answer: true. Rationale: theophylline has a narrow therapeutic index, requiring monitoring to prevent toxicity, especially cardiac and CNS effects. 90. Erythromycin is known to cause QT interval prolongation. True or false? Answer: true. Rationale: Erythromycin may prolong the QT interval, increasing the risk for life-threatening arrhythmias like torsades de pointes. 91. Naloxone can be administered intranasally. True or false? Answer: true. Rationale: naloxone can be given intranasally to reverse opioid overdose, offering rapid absorption and ease of use in emergencies. 92. Morphine is contraindicated in patients with head injuries. True or false? Answer: true. Rationale: morphine can increase intracranial pressure, worsening the condition in patients with head trauma. 93. Methotrexate is classified as a disease-modifying antirheumatic drug, DMARD. True or false? Answer: true. Rationale: methotrexate is a DMARD used in autoimmune diseases like rheumatoid arthritis to slow disease progression. 94. Atenolol is a calcium channel blocker. True or false? Answer: false. Rationale: atenolol is a beta blocker, not a calcium channel blocker. It reduces heart rate and blood pressure. 95. Ciprofloxacin should not be taken with antacids. True or false? Answer: true. Rationale: antacids containing aluminum or magnesium can interfere with ciprofloxacin absorption, reducing efficacy. 96. Lithium levels must be monitored to prevent toxicity. True or false? Answer: true. Rationale: lithium has a narrow therapeutic range, and toxicity can lead to tremors, confusion, seizures, or renal damage. 97. Clindamycin is associated with a risk of Clostridioides difficile infection. True or false? Answer: true. Rationale: clindamycin use can disrupt gut flora and increase the risk of C. difficile overgrowth and colitis. 98. Ibuprofen can be safely used during all trimesters of pregnancy. True or false? Answer: false. Rationale: ibuprofen should be avoided in the third trimester due to the risk of premature closure of the ductus arteriosus. 99. Albuterol is a short-acting beta agonist used for acute asthma relief. True or false? Answer: true. Rationale: albuterol causes rapid bronchodilation, relieving bronchospasm in acute asthma attacks. 100. Simvastatin should be taken in the morning. True or false? Answer: false. Rationale: statins like simvastatin are typically taken at night when cholesterol synthesis is highest. 101. Prednisone is an immunosuppressant corticosteroid. True or false? Answer: true. Rationale: prednisone suppresses the immune response and inflammation, commonly used in autoimmune diseases. 102. Gentamicin is ototoxic and nephrotoxic. True or false? Answer: true. Rationale: gentamicin can cause damage to the kidneys and inner ear, requiring monitoring of drug levels and renal function. 103. Ranitidine is a proton pump inhibitor. True or false? Answer: false. Rationale: ranitidine is an H2 receptor antagonist, not a PPI. It reduces acid production, but through a different mechanism. 104. Diazepam can cause respiratory depression when combined with alcohol. True or false? Answer: true. Rationale: both diazepam and alcohol are CNS depressants and can synergistically depress respiratory drive. 105. Lisinopril is an angiotensin receptor blocker, ARB. True or false? Answer: false. Rationale: lisinopril is an ACE inhibitor, not an ARB. It inhibits conversion of angiotensin I to II. 106. Bupropion is contraindicated in patients with a seizure disorder. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold and should not be used in individuals with seizure disorders. 107. Diphenhydramine is a first-generation antihistamine that causes sedation. True or false? Answer: true. Rationale: diphenhydramine crosses the blood-brain barrier and causes sedation, unlike second-generation antihistamines. 108. Hydrochlorothiazide can cause hyperkalemia. True or false? Answer: false. Rationale: thiazide diuretics like hydrochlorothiazide can cause hypokalemia due to increased potassium excretion. 109. Buspirone has a high potential for addiction. True or false? Answer: false. Rationale: buspirone is a non-benzodiazepine anxiolytic with low abuse and dependence potential. 110. Iron supplements should be taken with milk to improve absorption. True or false? Answer: false. Rationale: calcium in milk interferes with iron absorption. Iron is best taken with vitamin C or on an empty stomach. 111. Amiodarone is used to treat both atrial and ventricular arrhythmias. True or false? Answer: true. Rationale: amiodarone is a broad-spectrum antiarrhythmic effective against multiple types of arrhythmias. 112. Tamsulosin is used to treat benign prostatic hyperplasia, BPH. True or false? Answer: true. Rationale: tamsulosin is an alpha-1 blocker that relaxes prostate and bladder neck muscles, improving urine flow. 113. Methyldopa is safe for managing hypertension during pregnancy. True or false? Answer: true. Rationale: methyldopa is one of the preferred antihypertensive agents for use in pregnancy due to its safety profile. 114. Diltiazem is contraindicated in patients with heart block without a pacemaker. True or false? Answer: true. Rationale: diltiazem can worsen conduction defects in heart block, especially without a pacemaker. 115. Sucralfate requires an acidic environment to be effective. True or false? Answer: true. Rationale: sucralfate forms a protective barrier on ulcers in acidic environments. Antacids reduce its effectiveness. 116. Rifampin may cause orange discoloration of body fluids. True or false? Answer: true. Rationale: rifampin is known to turn urine, sweat, and tears orange, which is a harmless but notable side effect. 117. Captopril can cause a persistent dry cough. True or false? Answer: true. Rationale: ACE inhibitors like captopril increase bradykinin levels, which can cause a dry cough. 118. Levodopa is used to treat symptoms of Parkinson's disease. True or false? Answer: true. Rationale: levodopa replenishes dopamine levels in the brain, improving motor symptoms of Parkinson's disease. 119. Teratogenic drugs are safe during the first trimester of pregnancy. True or false? Answer: false. Rationale: the first trimester is a critical period for fetal organ development. Teratogenic drugs can cause birth defects. 120. Serotonin syndrome is a potential complication of combining SSRIs and MAO inhibitors. True or false? Answer: true. Rationale: concurrent use of SSRIs and MAOIs can lead to serotonin overload, resulting in serotonin syndrome, a life-threatening condition. 121. Warfarin therapy requires regular monitoring of INR levels. True or false? Answer: true. Rationale: warfarin affects blood clotting, so INR must be monitored to ensure therapeutic and safe dosing. 122. The antidote for benzodiazepine overdose is naloxone. True or false? Answer: false. Rationale: flumazenil is the specific antidote for benzodiazepine overdose. Naloxone is used for opioid overdose. 123. Glipizide is an oral antidiabetic drug that stimulates insulin secretion. True or false? Answer: true. Rationale: glipizide is a sulfonylurea that increases pancreatic insulin secretion, used in type 2 diabetes. 124. A side effect of nitroglycerin is headache. True or false? Answer: true. Rationale: nitroglycerin causes vasodilation, often leading to headaches as a common side effect. 125. Digoxin toxicity may present with yellow-green vision changes. True or false? Answer: true. Rationale: one hallmark symptom of digoxin toxicity is visual disturbances, such as yellow or green halos. 126. Omeprazole should be crushed before administration to enhance absorption. True or false? Answer: false. Rationale: omeprazole is enteric-coated to prevent degradation by stomach acid. It should not be crushed. 127. Loratadine is a sedating antihistamine. True or false? Answer: false. Rationale: Loratadine is a second-generation antihistamine with minimal sedative effects compared to first-generation drugs. 128. Clopidogrel is used to prevent platelet aggregation. True or false? Answer: true. Rationale: clopidogrel inhibits ADP-mediated platelet aggregation, reducing the risk of clot formation. 129. Insulin glargine has a peak effect 2 hours after administration. True or false? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak, providing steady action over 24 hours. 130. Theophylline toxicity may cause seizures and arrhythmias. True or false? Answer: true. Rationale: theophylline has a narrow therapeutic range, and toxicity can lead to CNS stimulation and cardiac disturbances. 131. Furosemide is a potassium-sparing diuretic. True or false? Answer: false. Rationale: furosemide is a loop diuretic that promotes potassium loss. It is not potassium-sparing. 132. A major side effect of haloperidol is extrapyramidal symptoms. True or false? Answer: true. Rationale: haloperidol, a typical antipsychotic, often causes movement disorders like dystonia and akathisia. 133. Acetaminophen overdose primarily affects the kidneys. True or false? Answer: false. Rationale: acetaminophen overdose leads to liver toxicity, potentially resulting in hepatic failure. 134. Metoprolol may mask symptoms of hypoglycemia. True or false? Answer: true. Rationale: beta blockers like metoprolol can blunt signs of low blood sugar, such as tachycardia. 135. Fluoxetine is classified as a selective serotonin reuptake inhibitor, SSRI. True or false? Answer: true. Rationale: fluoxetine is an SSRI that increases serotonin levels to treat depression and anxiety. 136. Nifedipine may be used to manage preterm labor. True or false? Answer: true. Rationale: nifedipine, a calcium channel blocker, relaxes uterine muscles and can delay labor. 137. Metformin can cause lactic acidosis in patients with renal impairment. True or false? Answer: true. Rationale: impaired kidney function can lead to metformin accumulation and increased risk of lactic acidosis. 138. Salmeterol is used for acute asthma attacks. True or false? Answer: false. Rationale: salmeterol is a long-acting beta agonist, not suitable for immediate relief of asthma symptoms. 139. Vancomycin must be infused slowly to avoid red man syndrome. True or false? Answer: true. Rationale: rapid infusion of vancomycin can cause flushing, rash, and hypotension due to histamine release. 140. Phenytoin can cause gingival hyperplasia as a side effect. True or false? Answer: true. Rationale: chronic phenytoin use often results in overgrowth of gum tissue, especially with poor oral hygiene. 141. Isotretinoin is safe to use during pregnancy. True or false? Answer: false. Rationale: isotretinoin is highly teratogenic and contraindicated in pregnancy due to risk of severe birth defects. 142. Enoxaparin is administered intramuscularly. True or false? Answer: false. Rationale: enoxaparin is a low molecular weight heparin administered subcutaneously, not intramuscularly. 143. Acetylcysteine is an antidote for acetaminophen overdose. True or false? Answer: true. Rationale: acetylcysteine replenishes glutathione stores and prevents liver damage after acetaminophen overdose. 144. Tetracycline should be taken with dairy products for best absorption. True or false? Answer: false. Rationale: dairy products interfere with tetracycline absorption by forming insoluble complexes. 145. Levothyroxine is best taken with food to reduce gastric irritation. True or false? Answer: false. Rationale: levothyroxine should be taken on an empty stomach for optimal absorption. 146. Fluticasone is an inhaled corticosteroid used in asthma management. True or false? Answer: true. Rationale: fluticasone reduces airway inflammation and is used regularly to prevent asthma exacerbations. 147. Risedronate should be taken lying down to aid absorption. True or false? Answer: false. Rationale: bisphosphonates like risedronate must be taken upright to prevent esophageal irritation. 148. A serious side effect of clozapine is agranulocytosis. True or false? Answer: true. Rationale: clozapine can severely suppress white blood cells, requiring regular monitoring of WBC and ANC. 149. Docusate sodium is a stimulant laxative. True or false? Answer: false. Rationale: docusate sodium is a stool softener, not a stimulant. It promotes easier bowel movements by softening stool. 150. Zolpidem is used to treat insomnia. True or false? Answer: true. Rationale: zolpidem is a non-benzodiazepine sedative hypnotic used for short-term treatment of sleep difficulties. 151. Albuterol is a long-acting beta agonist used for maintenance therapy in asthma. True or false? Answer: false. Rationale: albuterol is a short-acting beta agonist, SABA, used for quick relief in asthma attacks, not maintenance. 152. Amiodarone is commonly used to treat ventricular arrhythmias. True or false? Answer: true. Rationale: amiodarone is an antiarrhythmic drug effective against life-threatening ventricular arrhythmias. 153. Methotrexate is a chemotherapeutic agent and immunosuppressant. True or false? Answer: true. Rationale: methotrexate is used in cancer and autoimmune disorders like rheumatoid arthritis due to its immunosuppressive effects. 154. Hydrochlorothiazide increases potassium levels. True or false? Answer: false. Rationale: thiazide diuretics like hydrochlorothiazide can cause potassium loss, leading to hypokalemia. 155. Rifampin may cause red-orange discoloration of body fluids. True or false? Answer: true. Rationale: rifampin, used in tuberculosis treatment, often causes harmless discoloration of urine, tears, and sweat. 156. Atenolol is contraindicated in patients with bradycardia. True or false? Answer: true. Rationale: as a beta blocker, atenolol reduces heart rate and should not be given to bradycardic patients. 157. Naloxone can reverse the effects of benzodiazepines. True or false? Answer: false. Rationale: naloxone is used for opioid reversal. Benzodiazepine overdose is reversed with flumazenol. 158. Atropine is used to treat symptomatic bradycardia. True or false? Answer: true. Rationale: atropine increases heart rate by blocking parasympathetic input, making it effective for symptomatic bradycardia. 159. Propofol is a long-acting sedative hypnotic used for chronic insomnia. True or false? Answer: false. Rationale: propofol is an ultra-short-acting anesthetic used for induction and maintenance of anesthesia, not for insomnia. 160. Buspirone is effective for immediate relief of anxiety symptoms. True or false? Answer: false. Rationale: buspirone has a delayed onset and is used for long-term management of anxiety, not for acute relief. 161. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. True or false? Answer: true. Rationale: ciprofloxacin is a fluoroquinolone effective against a wide range of bacterial infections. 162. Antacid should be taken at the same time as other oral medications. True or false? Answer: false. Rationale: antacids can interfere with the absorption of many oral drugs and should be spaced by at least 1 to 2 hours. 163. Bupropion is associated with increased seizure risk, especially in high doses. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold, especially when dosed above recommended limits. 164. Lidocaine can be used as both a local anesthetic and antiarrhythmic agent. True or false? Answer: true. Rationale: lidocaine is used locally for anesthesia and intravenously for ventricular arrhythmias. 165. Carbamazepine is safe for use during pregnancy. True or false? Answer: false. Rationale: carbamazepine is teratogenic and associated with neural tube defects. Caution is required during pregnancy. 166. Spironolactone is a potassium-sparing diuretic. True or false? Answer: true. Rationale: spironolactone inhibits aldosterone, promoting sodium excretion while retaining potassium. 167. Simvastatin is most effective when taken in the morning. True or false? Answer: false. Rationale: simvastatin is typically taken in the evening when cholesterol synthesis is highest during sleep. 168. Gabapentin is commonly used to treat neuropathic pain. True or false? Answer: true. Rationale: gabapentin is an anticonvulsant also effective in treating nerve-related pain conditions. 169. Acetylsalicylic acid, aspirin, should be avoided in children with viral infections. True or false? Answer: true. Rationale: aspirin in children with viral illness is linked to Reye's syndrome, a potentially fatal condition. 170. Diazepam has a short half-life and is used for daily anxiety control. True or false? Answer: false. Rationale: diazepam has a long half-life and is more suited for acute anxiety or procedural sedation, not daily long-term use. 171. Phenazopyridine treats urinary tract infection by killing bacteria. True or false? Answer: false. Rationale: phenazopyridine is a urinary analgesic, not an antibiotic. It relieves discomfort, but does not treat the infection. 172. Ketorolac should not be used for more than 5 days due to risk of GI and renal toxicity. True or false? Answer: true. Rationale: prolonged use of ketorolac increases the risk of serious side effects including gastrointestinal bleeding and kidney damage. 173. Levodopa must be taken with high-protein meals for maximum absorption. True or false? Answer: false. Rationale: high-protein foods compete with levodopa for absorption and can reduce its effectiveness. 174. Lactulose helps lower ammonia levels in hepatic encephalopathy. True or false? Answer: true. Rationale: lactulose promotes ammonia excretion in the colon, making it useful in treating hepatic encephalopathy. 175. Sucralfate forms a protective barrier over ulcers in the stomach. True or false? Answer: true. Rationale: sucralfate adheres to ulcer sites and protects them from acid, promoting healing. 176. Morphine can cause respiratory depression as a serious side effect. True or false? Answer: true. Rationale: as an opioid, morphine can suppress respiratory drive, especially in high doses or with other sedatives. 177. Allopurinol is used for acute gout attacks. True or false? Answer: false. Rationale: allopurinol is used for long-term management of gout by reducing uric acid levels, not for acute attacks. 178. Chlorpromazine is a first-generation antipsychotic. True or false? Answer: true. Rationale: chlorpromazine is a typical antipsychotic that works by blocking dopamine receptors. 179. Neostigmine is used in the treatment of myasthenia gravis. True or false? Answer: true. Rationale: neostigmine increases acetylcholine levels, improving muscle strength in patients with myasthenia gravis. 180. Propranolol is a selective beta-1 blocker. True or false? Answer: false. Rationale: propranolol is a non-selective beta blocker, affecting both beta-1 and beta-2 receptors. 181. Metformin can cause lactic acidosis in patients with renal impairment. True or false? Answer: true. Rationale: metformin is contraindicated in patients with significant renal impairment due to the risk of lactic acidosis, a rare but serious side effect. 182. Clopidogrel is an anticoagulant that directly inhibits thrombin. True or false? Answer: false. Rationale: Clopidogrel is an antiplatelet agent that inhibits ADP-mediated platelet aggregation, not a direct thrombin inhibitor. 183. Nifedipine is a calcium channel blocker used to manage hypertension and angina. True or false? Answer: true. Rationale: nifedipine relaxes vascular smooth muscle, lowering blood pressure and relieving anginal symptoms. 184. Warfarin therapy requires monitoring of INR levels. True or false? Answer: true. Rationale: warfarin affects vitamin K-dependent clotting factors and requires INR monitoring to maintain therapeutic range and prevent bleeding. 185. Enoxaparin is given orally for DVT prophylaxis. True or false? Answer: false. Rationale: enoxaparin is a low-molecular weight heparin administered subcutaneously, not orally. 186. Omeprazole is a proton pump inhibitor that reduces stomach acid production. True or false? Answer: true. Rationale: omeprazole blocks gastric H+/K+ ADPase pumps, reducing acid secretion and treating GERD and ulcers. 187. Digoxin is contraindicated in patients with hypokalemia. True or false? Answer: true. Rationale: hypokalemia increases the risk of digoxin toxicity, which can cause dangerous arrhythmias. 188. Vancomycin should be infused rapidly to achieve therapeutic levels quickly. True or false? Answer: false. Rationale: rapid infusion of vancomycin can cause red man syndrome, so it should be infused slowly over at least 60 minutes. 189. Tetracyclines should not be taken with milk or antacids. True or false? Answer: true. Rationale: calcium and antacids can bind tetracyclines and reduce their absorption and efficacy. 190. Phenytoin can cause gingival hyperplasia with long-term use. True or false? Answer: true. Rationale: a common side effect of chronic phenytoin therapy is gingival overgrowth, requiring good oral hygiene. 191. Furosemide can cause ototoxicity, especially when administered rapidly. True or false? Answer: true. Rationale: high doses or rapid for administration of furosemide can cause reversible or irreversible hearing loss. 192. Insulin glargine has a peak action 2 hours after administration. True or false? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak. It provides steady levels over 24 hours. 193. Lithium toxicity is more likely in patients with low sodium levels. True or false? Answer: true. Rationale: hyponatremia leads to increased lithium reabsorption in the kidneys, increasing toxicity risk. 194. Nitroglycerin patches can be left on continuously for 24 hours. True or false? Answer: false. Rationale: continuous exposure leads to tolerance. Patches should be removed for 10 to 12 hours daily. 195. SSRIs increase serotonin levels in the synaptic cleft. True or false? Answer: true. Rationale: SSRIs block serotonin reuptake, enhancing its availability and improving mood and depression. 196. Beta blockers may mask symptoms of hypoglycemia in diabetic patients. True or false? Answer: true. Rationale: beta blockers can blunt signs of hypoglycemia like tachycardia and tremors, posing a risk in diabetes. 197. Acetaminophen overdose can cause hepatotoxicity. True or false? Answer: true. Rationale: high doses of acetaminophen overwhelm liver detoxification pathways, leading to liver damage. 198. Diltiazem is used to treat hypertension and atrial fibrillation. True or false? Answer: true. Rationale: diltiazem is a calcium channel blocker that lowers blood pressure and slows heart rate, useful in atrial fibrillation. 199. Fluoxetine is an SSRI that may take several weeks to reach full therapeutic effect. True or false? Answer: true. Rationale: like most antidepressants, fluoxetine may take 4 to 6 weeks to achieve full benefits. 200. Prednisone must be stopped abruptly after long-term use. True or false? Answer: false. Rationale: abrupt cessation of prednisone after prolonged use can lead to adrenal insufficiency. Tapering is required.